This is Nancy Daniels from Brevard College doing my bone identification project. First, we have the scapula. This is the spine of the scapula, the infraspinous fossa, the supraspinous fossa, the glenoid fossa, the subscapular fossa. This is the acromion process, the coracoid process, the lateral border, the medial border, the inferior angle, the superior angle, the suprascapular notch going down there, and that is the scapula. This is the clavicle. What we have here is the right clavicle. This is the lateral end or the acromion. This is the sternal end or the medial end. Humerus. This is the head of the humerus, the anatomical neck, the surgical neck, the greater tubercle, the lesser tubercle, the bicipital groove, the deltoid tuberosity along the front, and the radial groove on the posterior side. We have the trochlea, the capitulum, the medial epicondyle, the lateral epicondyle, the medial supracondylar ridge, the lateral supracondylar ridge, the coronoid fossa, the radial fossa, and on the posterior side is the olecranon fossa. We have the ulna. This is the olecranon process, the coronoid process, the trochlea, the radial notch, the head of the ulna, and the styloid process. And that is this is the radius. This is the head of the radius, the neck of the radius, the radial tuberosity. This is the styloid process, and on the side here is the ulnar notch. And this is the humerus. We have the scaphoid, the lunate, the triquetral, the pisiform, the trapezium, the trapezoid, the capitate, and the hamate. Here we have 1, 2, 3, 4, and 5 metacarpals. This is the first, second, third, fourth, fifth proximal phalange. This is the second, third, fourth, fifth middle phalange. And this is the first, second, third, fourth, fifth distal phalange. And that is our hand. This is the pelvis. And first we're going to do the ilium. And this is the iliac crest. Follow it down to the anterior superior iliac spine. Down here to the anterior inferior iliac spine. Follow the crest posteriorly to the posterior superior iliac spine, down to the posterior inferior iliac spine. Then we have the notch of the greater sciatic and the acetabular here where the socket is, and the other side is indented is the iliac fossa. And that is the ilium. We're back on the pelvis, but this time the ischium. And here, this large protrusion is the ischial spine. Just below it is the lesser sciatic notch. This big bump is the ischial tuberosity where you sit. And here is the ischial ring. And that is the pelvis. As part of the pelvis, the pubis, we're going to start now. This is the superior ramus. This is the inferior ramus. This hole is the obturator foramen. Up here is the pubic crest, and along this ridge here is the pubic symphysis. And that is our pubis of the... Now we're starting on the femur. This is the head of the femur, the neck around here, the greater trochanter, the lesser trochanter, the intertrochanteric line in the front anteriorly, and the posterior is the intertrochanteric crest. This below it is the gluteal tuberosity, and below that is the linea aspera, is all this way. And then we have the lateral condyle down here, in the medial condyle, and this is the lateral epicondyle, and the medial epicondyle, and the patella surface on the inferior side, and the intercondylar fossa on the posterior side. And that is all. This is the patella. The patella sits on the femur, and to tell left from right, you just balance it and let it fall, while to the right, so it's a right. This superior is the base, and the inferior is the apex. And on the back, the posterior are the facet surfaces here and here. And that is the foot. Here we have the right foot. This is the calcaneus. Up here is the talus. This is the navicular going around here. This is the cuboid. And we have the medial cuneiform, the intermediate cuneiform, and the lateral cuneiform. We have the 1, 2, 3, 4, and 5 metatarsals. Down here are the bases of those, and up here are the heads of the metatarsals. Next, we have the proximal phalanges. This is 1, 2, 3, 4, and 5. Next, we have the middle phalanges. We have number 2, 3, 4, and 5. And the distal phalanges, 1, 2, 3, 4, and 5. And that is our... This is the foot again, but individual bones of the tarsal. This is the navicular, which sits onto the talus to the left. This is the talus, which has an indentation that fits onto the calcaneus. And this is a left, and this is a left calcaneus. And as Dr. Canali told you, you couldn't find a cuboid, but here it is on the lateral side of the foot. It looks like a cube on the superior side. Inferiorly, it looks like a cuboid. So there we have the individual bones of